Alright, welcome back. Alright, so the verse we're going to pick today is the Lord bless you and watch you, guard and keep you. Numbers 6:24. Okay, and with that we shall start. Okay, remember I am studying, so I'll take gaps in between. If there's gaps, I'm not going fast enough, you can always speed up the video to 1.75, and I'll be running through everything. You'll get all the details. However, if you're taking notes, you can always go down to 0.5. It's in the YouTube settings to go slow or fast forward for those of you who do not know. And so, syphilis. Syphilis is caused by a spirochete, Trypanosoma pallidum. Which one are the spirochetes? It is Treptonema. It is Leptospira, and it is Borrelia. Okay, and there are only three spirochetes, and they are Borrelia, Leptospira, and Treptonema. Okay, so this is Treptonema pallidum is a spirochete, and it causes syphilis. What is syphilis? It is an STD. Treatment is with penicillin G. Okay, treatment. Primary syphilis is a localized disease presenting with painless chancre. Painless chancre. Okay, it is not painful. You will only know you have it if you look at it. This is what it looks like. It looks painful, but it's not. Okay, this is this figure right here. Okay, now, painless chancre. You use fluorescent or dark field microscopy to visualize treptonemes in fluid from the chancre. This is in B. Remember, dark field microscopy is completely dark, and this spirochete, this spiral thing, will show up on dark field microscopy. And this is the classical picture of syphilis. Okay, microbiological picture of syphilis. And it is VDRL positive in about 80% of the cases. VDRL, remember this, VDRL positive in 80% of the cases. What does VDRL stand for? VDRL. Venereal Disease Research Laboratory Test. Okay, and this is a test that is used for the screening of syphilis. Okay, you don't have to know the details of how it's done. You just have to know that it is for syphilis. This test is for syphilis. Well, again, to you were questions where it can be false positive and how you can differentiate. Okay, when we get there. Secondary syphilis is a disseminated disease with constitutional symptoms: maculopapular rash, which is C. We're gonna go in there. We're gonna get in there. See this maculopapular rash? Maybe that's not a good picture. I can show you here. Maculopapular rash. See this? This is it. These are macules, and this is a papule. Maculopapular rash is made of both flat and raised lesions. A macular papular rash is a marker of many diseases, allergic reaction, and infection. Most of the time, it's caused by a viral infection. Okay. So in this case, syphilis is a bacterial infection. Papule. So macule is the flattened out one. Papule is the raised one. Okay, it's a rash. Okay, where'd it go? Yeah, so skin, macule, is a flattened area of red, and raised bumps are papules. Okay, and together they're called macular papular rash. Flat and raised skin bumps. Okay, including the palms and soles. So in syphilis, you're going to have this type of rash, macular papular rash, on the palms of your hands and the soles. Okay? Alright. And condylomata lata. Okay. Yeah, you can laugh at me. I don't know how to say it. Condylomata lata. So this is what that is. It is a symptom of secondary syphilis on the genitals. It is smooth, painless, wart-like white lesions on the genitals. You can look up more pictures if you'd like. The reason I'm showing you pictures is that you're never gonna forget it. You're never going to forget if I show you what this is. Condylomata lata. Okay. See, this it looks like cauliflower. So the second stage of syphilis looks like cauliflower right here on the genitals. Cauliflower-like projections coming from the vagina and anus, penis, all everywhere. Look at this. So it's just a heart disease. I mean, oh my gosh. So this is it. Remember, syphilis, second stage of syphilis. Okay. Lymphadenopathy, patchy hair loss, also confirmable with dark field microscopy, serologic testing. You can do VDRL RPR test, but it is non-specific. You confirm the diagnosis with specific tests, which is FTA ABS. Remember this. They ask this. You confirm the diagnosis with the specific test, FTA ABS. Okay. What is it? What is FTA ABS? FTA ABS. It stands for FTA-ABS stands for fluorescent tryptonymal antibody absorption test. So any kind of antibody test will be specific, yeah. So this test is used to detect antibodies to syphilis in the blood. So yeah, this is an antibody test. It will detect the syphilis in the blood. So VDRL RPR is non-specific. FTA ABS is very specific for syphilis. And it is confirmatory. Secondary syphilis is systemic, which means it affects the entire body. Latent syphilis, you have positive serology without symptoms. So latent syphilis, you'll be positive on the DRL test, but you will not have symptoms. Okay. Tertiary syphilis. Tertiary syphilis is gummas. It is marked by gummas, which is F over here. See this? Gummas. Okay, so these are large lesions. Right here. Yeah, So it's like it's a very frightening disease, I would say, syphilis, because just because of the way it looks. So, in fact, infectious disease is extremely interesting. I could never do it because it's so interesting. It's one of my interests actually, but I can't do it. Okay, um, gammas, chronic granuloma. So gammas are made out of granulomas. Yeah, these huge masses that are on your face. It can be anywhere, but it's on your face mostly. Um, aortitis, which is vasa vasorum destruction. What is a vasa vasorum? Vasa vasorum is is this. It is the outside of the blood vessel. Okay, so okay, vasa vasorum is the outside of the blood vessel. Um, okay, and tertiary syphilis comes and destroys that. It destroys the vasa vasorum of the aorta. So that's why you get aortitis. So that's aortitis. Aortitis. It is the inflammation of the aorta. So that is the which one is that? Sometimes it's important to look at x-rays too. But let's see, where is it? Okay, so I'll show you first here. Aortitis. Okay, so this is the aorta right here. Um, it is the inflammation of the aorta. Okay, so come back here. This is the aorta, and it's the inflammation of the aorta, and this can be seen in tertiary syphilis. Okay. Okay. So okay. So vascular destruction of the aorta, then neurosyphilis. In neurosyphilis, you get tabes dorsalis. What is tabes dorsalis? Tabes dorsalis is dorsal column degeneration, shooting pain, oral Robertson Peoples, ataxia, impaired proprioception, syphilis. Yeah, so it's a neurological late consequence of neurosyphilis, a complication of untreated syphilis that causes the gradual degeneration of nerve tracts and spinal cord. So this one destroys your nerves. Okay. All right. So this is typically seen in later stage of syphilis. So neurosyphilis, tabes dorsalis, general paresis. Okay. Paresis. So general weakness, general paresis is a weakness caused by nerve damage in your body. So it's a partial paralysis. Okay. Argyle Robertson pupil is when the pupil constricts with accommodation, but is not reactive to light. Okay. So, what is accommodation? Accommodation. Accommodation is when the eye adjusts to its focus to see objects clearly at different distances. Okay. So here, constricts Argyle Robertson pupil constricts with accommodation. So it constricts to adjust to near and far objects, but the pupil does not react to light. So you know how when you shine the light in somebody's eye, it's supposed to be equal and reactive. So when you shine the light in someone's eye, light reflects in eye. So see this. When there is no light, this is these normal, and it's dilated. A normal response to light. Normal response to light is the eye will the pupil will constrict because somebody's shining a light in your eye, right? Now, if there's no light, or just even regular darkness, or in darkness or regular light, your eye will adjust to see better. This is a sympathetic response. Your eye will get into autonomics, but this is a sympathetic response. Your eyes will dilate to see better in light. In darkness. Oh my gosh, in darkness. This is no light. In like regular lighting or darkness. Now, normal response to light. Whereas if I take the same patient and I shine light in their eyes, the pupil is supposed to get smaller, supposed to constrict. You're supposed to have meiosis, right? No light is mydriasis. Normal response to light is meiosis. Okay. All right. So. Exactly. So this is what it's saying. This lady's pupil has shrunken. It's meiosis when you shine light. Okay. So when you shine light in one eye, your pupil will constrict, and the normal reaction is for the second pupil to also constrict. It's known as consensual pupillary light reflex. When you shine light in the right eye, the left eye will also constrict. That's normal. You can test this out on someone in your household. Just shine light in one eye and see what happens to the other eye. Okay, so that is they're both supposed to constrict. Now, what happens here is that in tertiary syphilis, Um, the pupil constricts with accommodation, which is adjusting. The eye will constrict to see near and far objects, but the eye will not constrict when light is shined in their eye or shown in their eye. So yeah, also called prostitute's pupil, since it accommodates but does not react. Okay, so it's also called prostitute's pupil. Okay, so that's there. What is that? What is prostitute's pupil? Why is it called that? Prostitute pupil. This is interesting. Argyll Robertson pupils are also sometimes called prostitute pupils because of their association with late neurosyphilis. Okay, so I guess you can think of it as STD, prostitute, neurosyphilis. Conveniently, a popular mnemonic to remember Argyll Robertson pupil is that just like prostitutes, the pupils will accommodate but do not react. I guess what they're saying is prostitutes accommodate to what you want, but don't demand things. Okay, people have very strange ways to remember things. All right. Okay. Signs: broad-based ataxia. What is ataxia? This is ataxia. Walking, it's you can't walk properly. You have a very strange gait, fatigue, trouble eating, speaking, tremors. It's mainly imbalance issue. Okay, so that's that. Positive Romberg sign. I don't know what that is. What is positive Romberg sign? What is positive Romberg? What is positive Romberg sign? Okay, this is positive Romberg sign. Romberg test is a neurological exam that is used to treat for balance and coordination. Romberg test assesses the patient's ability to stand with the feet parallel and together, and with the feet parallel and together, with the eyes open and then closed for 30 seconds. So the patient is asked to stand with their feet right next to each other and eyes open and then closed for 30 seconds. Basically, you're testing to see their balance. Dorsal column, dorsal impaired proprioception. All right. So they're gonna fall over if their balance is off. So yeah, you're supposed to be standing like this, and then have your eyes open or closed for 30 seconds, and have them close eyes. Romberg is positive if they do worse with eyes closed. So basically, if their eyes are closed and then they fall over, you have a positive Romberg sign. So yeah, so basically Romberg is positive if they do worse with eyes closed. Okay, so in neurosyphilis you're going to have it's tertiary syphilis. Neurosyphilis is a symptom of tertiary syphilis. So signs of tertiary syphilis is broad-based ataxia, which is an imbalance, it is then you also have positive Romberg sign, which is when you have your when you're standing with your eyes open, you're okay, but then when you're standing with your eyes closed, you tip over. That is a positive Romberg sign. So I'm gonna make a note of that. Okay. Okay. You tip over when eyes are closed. You tip over when eyes are closed. Tip over. You tip over yeah, I think when eyes are closed, but are okay. But are okay when eyes are open. When eyes are open. Okay. All right. And then when Arga Robertson pupil is pupils pupil people neither pupil constricts when light is shown in one eye. The other eye is normally supposed to constrict when light is shown in opposite eye. Okay. All right. So neither pupil constricts when light is shown in one eye. The other eye is normally supposed to constrict when light is shown in opposite eye. Okay. All right. Pupil. Okay. Positive Romberg test. Charcot joint. What is that? Charcot joint. Charcot joint. What is Charcot joint? Charcot joint is also known as a neuropathic arthropathy. It's a condition characterized by breaking down of the bones, muscles, and joints due to nerve damage. All right, that's oh my goodness. So swollen joint. Okay. So it's when your bones break down because of nerve damage. That looks extremely painful, yeah. Okay, Charcot joint. Bones break down. Bones break down because of nerve damage. that's that. So in tertiary syphilis, you see a positive Romberg sign, Charcot joint. Then you also see stroke without hypertension, so you can just get a stroke. And then for neurosyphilis, you test the spinal fluid with a VDRL, FTA, ABS, and PCR. Okay. Now congenital syphilis presents with facial abnormalities such as ruggades. Ruggades is it linear scars at the angle of the mouth. So this is seen in picture G. Okay, right here. So that's called ruggades. Scars at the angle of the mouth. Okay. G, ruggades. I'm gonna make a note of that. Okay, ruggades. Okay. Yeah, that is ruggades. Okay. Snuffles. Nasal discharge, which is the red arrow in G. So that's known as snuffles. Snuffles, that's a nasal discharge. Nasal discharge. Snuffles. Snuffles, which is nasal discharge seen in congenital syphilis. Discharge seen in congenital SYPHILIS. Syphilis. Okay, so that's that. Saddle nose, notched teeth, which is seen in H, right here, down here. So you also see this in congenital syphilis. So it's Hutchinson's teeth. Hutchinson's teeth. Hutchinson. Teeth. Hutchinson teeth. Seen in congenital. Syphilis. Congenital SYP. Syphilis. Okay. What is saddle nose? This is saddle nose. Okay, so the nasal bridge is destroyed and the tip is turned up. Okay, that's saddle nose. And you also see Hutchinson's teeth. mulberry molars. What is mulberry molars? What is mulberry molars? Okay, so mulberry molars, dental conditions associated with congenital syphilis, characterized by multiple rounded rudimentary enamel cups on permanent first molar, given the appearance of a mulberry. Okay, it's this thing. This kind of. It looks like a mulberry. Okay, I see. Okay, mulberry molars. Okay, and short maxilla and saber shins. What is short maxilla? So this part will be short, like there'll be less distance in the maxilla region in congenital syphilis. Saber shins, what is that? So this is when your tibia is deformed, presents with anterior bowing of the tibia. See this? And deformity tibia, anterior forward bowing. So your tibia, this is normal. The tibia in congenital syphilis will bend anteriorly forward. Looks like this saber shin. Saber sword with a curved blade. Okay. It's a bend forward. Anterior. So, okay. Why does this look like it's bent laterally? If it's bent forward, I would imagine it's bent. Okay, so bent forward. Okay, as here I guess you can see it. Bent forward, right? Yeah. So bent forward. Bent forward. Okay, you can definitely see. Okay, that's imperfected. Never mind. Okay, so Yeah, maybe you flip the Shaverson the other way. It's more. You can understand that more. Tibia is bent anteriorly. Tibia is bent anteriorly in congenital syphilis. Tibia is tibia is bent anteriorly in congenital syphilis like the okay. You have CN8 deafness, also in congenital syphilis. To prevent this, treat the mother early in pregnancy, as placental transmission typically occurs after the first trimester. So syphilis um, is if the mom has syphilis, it's gonna be transmitted to the baby after the first trimester. Okay, so you have to treat this very early in pregnancy, so the kid doesn't get any of the things that we just said, which is Brugades, snuffles, saddle nose, Hutchinson's teeth, mulberry molars, short maxilla, Shaverson's, or uh, cranial nerve 8 deafness. Okay, next. VDRL false positives. VDRL detects non-specific antibody that detects VDRL detects non-specific antibody that reacts with beef cardiolipin, a quantitative, inexpensive, and widely available test for syphilis. Sensitive but not specific. VDRL detects non-specific antibody. VDRL detects non-specific antibody that reacts with beef cardiolipin. Quantitative, inexpensive, and widely available test for syphilis. Sensitive but not specific. False positive results in VDRL with false positive results on VDRL with pregnancy, viral infection, drugs, rheumatic fever, lupus, and leprosy. Okay, so if somebody is pregnant, or they have viral infection, or if they are on the drugs chloropromazine or procainamide, or they have rheumatic fever or lupus or leprosy, they can test positive for syphilis, but this is wrong. This is known as false positive. Um, it's when you test falsely positive for syphilis. So you test falsely positive for a disease you don't have. If you're pregnant, uh, or if you have a virus like Epstein-Barr virus or hepatitis, or if you're on drugs like chloropromazine or procainamide, or if you have rheumatic fever or lupus or leprosy. But this is rheumatic fever one is rare. That's where you have to do the FTA ABS testing. Yeah, right here. So streptomelia specific FTA ABS testing, you have to do that as confirmatory. And then we have the next. We're gonna move on. I'm gonna make a note of this. Okay. You can falsely test positive for syphilis, SYP, if you have any of these conditions, so you must do FTA ABS test. Okay, now next we're going to move on to Hersheimer reaction. This is a flu-like symptom that consists of fever, chills, headache, and myalgia after antibiotics are started. This is due to killed bacteria, usually spirochetes releasing toxins. Okay, flu-like symptom. It's a flu-like symptom. You have fever, chills, headache, myalgia, and you get this after the antibiotics are started, and it's due to the killed bacteria, usually spirochetes, releasing their toxins. So yeah, after you give the antibiotics, you're killing off the spirochetes, and they're releasing toxin, which gives you flu. Okay, so after starting antibiotics, spirochetes release toxin, which give you flu-like symptoms. So next we're going to go into Gardnerella vaginalis. Gardnerella vaginalis is a pleomorphic gram-variable rod involved in bacterial vaginosis. It presents as a gray vaginal discharge with a fishy smell. It's not painful versus vaginitis, which is painful. Gardnerella vaginalis is associated with sexual activity but not sexually transmitted. Bacterial vaginosis is also characterized by overgrowth of certain anaerobic bacteria in the vagina due to decreased lactic bacilli. What you see here is clue cells. You have to know what they look like. Okay, clue cells are vaginal epithelial cells covered with Gardnerella, and they have stippled appearance along the outer margin, seen in A right here. Okay, I don't have a clue why I smell like fish in the vagina garden. Okay, amine whiff test is mixing discharge with 10% KOH enhances fishy odor. Okay. Treatment is with metronidazole or clindamycin. Okay, so here we're going to go through this. Pleomorphic. What does it mean to be pleomorphic? Pleomorphic bacteria. Pleomorphic bacteria Pleomorphic bacteria refers to the ability of an organism to alter its morphology and reproductive and other metabolic behavior in response to environmental change. So it just means that they change shape to better suit their environment. So Gardnerella is pleomorphic. It's a shapeshifter. A pleomorphic gram variable rod involved in the bacterial vaginosis. It presents as a gray vaginal discharge with a fishy smell. Okay, fishy smell. Okay, remember this. Fishy smell, not painful. Associated with sexual activity, but it is not sexually transmitted. It is not an STD. Not an STD. D. Um, Bacteriovaginosis is also characterized by overgrowth of certain anaerobic bacteria in the vagina due to decreased lactobacilli. Clue cells, you see clue cells here. So here, clue cells. Clue cells. This is a clue cell. Yeah. So, see, this is a clue cell, okay? Don't forget. So here, this is a normal cell of the vagina, and this is a clue cell. So the clue cell is coated. This is coated with Gardnerella vaginalis. Is coated with Gardnerella. Okay. Yeah. So these two cells are the same, except one is not infected with Gardnerella. The other one is infected with Gardnerella. That's why it's purple. It looks like this. Okay. All right. So clue cells are vaginal epithelial cells covered with Gardnerella. They have stable appearance along the outer margin. Amin whiff test is mixing discharge with 10% KOH. It's potassium hydroxide. So amine whiff test, mixing discharge with 10% potassium hydroxide. Amine whiff test, mixing discharge. So you mix the vaginal discharge. Mix the vaginal. You mix vaginal discharge. You mix vaginal discharge with 10% potassium hydroxide with 10% potassium hydroxide and you smell it and it produces a fishy odor. That's how you know you have it. With 10% potassium hydroxide and fishy odor gets worse. Treatment is the metronidazole or clindamycin. Okay. Next, going to chlamydia. All right, chlamydia is very important. They always ask about this. Chlamydia cannot make their own ATP. They are obligate intracellular organisms that cause two mucosal infections. Two forms as elementary, the elementary body. Small dent is infectious and enters cell by endocytosis, transforms into a reticulate body. Reticulate body replicates in cell by fission, reorganizes into elementary bodies. Chlamydia trachomatis causes neonatal and follicular adult conjunctivitis, which is seen in A over there. Non-gonococcal urethritis, pelvic inflammatory disease, and reactive arthritis. Chlamydiophilia pneumonia, and chlamydiophilia pistachii cause atypical pneumonia transmitted by aerosol. Chlamydia cell wall lacks classic peptidoglycan due to reduced uramic acid, rendering beta-lactam antibiotics ineffective. Cook, intracellular chlamydia pistachii has an avian reservoir, so this one is seen in parrots. It's in parrots. Causes a pneumonia, atypical pneumonia. Lab diagnosis PCR, nucleic acid amplification test. Cytoplasmic inclusions include reticular body seen on GEMSA or fluorescent antibody stain smear. Treatment is azithromycin flavored because one-time treatment, or doxycycline. You add ceftriaxone for possible concomitant concomitant gonorrhea infection. So here's what we have to go through. So chlamydia cannot make their own ATP. They live inside the cell. The intracellular, obligate intracellular organisms. They cause two types of infections. Elementary body, small dense, enters cell by endocytosis, transfers into some kind of reticular body. Reticular body, and the second one is that reticular body replicates in the cell by fission, reorganizes into elementary bodies. What are elementary bodies? Let's look. Elementary bodies in chlamydia. Elementary bodies are something that infects the host when cells ingest the elementary bodies through the process of receptor-mediated endocytosis. Once inside the cells, elementary bodies differentiate into reticular bodies, which are metabolically active and non-infectious. So the name of the inclusion bodies of chlamydia is reticular body. Okay, so inclusion bodies of chlamydia. Let's see. Inclusion body of chlamydia is inclusion body of chlamydia. Chlamydia is reticular body. Okay. So what happens is chlamydia, elementary body, is infectious, and chlamydia enters. Okay, chlamydia causes elementary bodies to form, and elementary bodies enters the cell by endocytosis, and makes a reticular body, and the reticular body replicates in the cell and reorganizes into elementary bodies. So you just have to know that inclusion body of chlamydia is a reticular body. That's all you have to know. And then chlamydia trachomatis causes neonatal and follicular adult conjunctivitis. So this is adult conjunctivitis. Adult conjunctivitis. Okay. Oh no. Conjunctivitis. Chlamydia also causes non-gonococcal urethritis, pelvic inflammatory disease, and reactive arthritis. Remember PID here. Okay. Now, chlamydia pneumonia and chlamydiophilia pistachi cause atypical pneumonia transmitted by aerosol. Aerosol transmission. So aerosol transmission is that it means that it's transmitted by infectious particles or droplets through inhalation or direct contact with mucous membranes in the respiratory tract. So basically, if somebody sneezes, somebody with chlamydiophilia pneumonia sneezes, and you're just walking by that area, you inhale it. That is aerosol transmission. It's transmitted by droplets. So these droplets are going into your mucous membranes, and through your mucous membranes it goes down to your lungs, causes pneumonia. Okay. Aerosol means transmitted by droplets. Transmitted by droplets. Okay. Chlamydia cell wall lacks a classic peptidoglycan due to reduced muramic acid. Chlamydia has less muramic acid, rendering beta-lactam antibiotics ineffective. Okay, so beta-lactam antibiotics don't work. Beta-lactam antibiotics antibiotics don't work. Beta-lactam antibiotics don't work in chlamydia. Don't work in chlamydia because chlamydia doesn't have muramic acid in cell wall, or they have decreased muramic acid. So beta-lactam antibiotics do not work. Alright. Chlamydia is intracellular. Chlamydia pistachii is carried in parrots. It causes pneumonia. Lab diagnosis PCR, or PCR, nucleic acid amplification test. Cytoplasmic inclusions are reticular bodies. Okay, remember this. Cytoplasmic inclusions are reticular bodies. It's seen on Gemza stain or fluorescent antibody stained smear. Treatment is with azithromycin. It's favored because you only have to give once, or doxycycline. You add ceftriaxone for possible concomitant gonorrhea. Okay, so you give for chlamydia you give azithromycin plus ceftriaxone, or you give doxycycline plus ceftriaxone. So treatment is azithromycin plus what? Azithromycin plus ceftriaxone, or doxycycline, plus plus ceftriaxone. Ceftriaxone is a magic drug. Okay, so next, chlamydia trachomatis serotypes, types A, B, and C. This one causes chronic infection, causes blindness due to the follicular conjunctivitis in Africa. Just remember this, A, B, C. A is for Africa, B is for blindness, C is for chronic infection. So main problem here is blindness. Okay, blindness. Types D through K causes urethritis and pelvic inflammatory disease, ectopic pregnancy, neonatal pneumonia, staccato cough. What is that? Staccato cough. Associated with chlamydia. It's a cough that presents as dry and brassy, maybe bizarre, with a honking or barking quality. Okay, so it sounds like a dog. Machine gun like. It sounds very scary. It sounds like a kind of machine gun or a dog. That kind of cough. Okay. Dog like cough. Dog like barking kind of cough. Okay. Neonatal pneumonia is a barking kind of cough. With eosinophilia, neonatal conjunctivitis, 1 to 2 weeks after birth. So after the baby is born, 2 weeks later, the kid gets neonatal conjunctivitis. Remember, this one is caused by chlamydia types D through K. Neonatal disease can be acquired during passage through the infected birth canal. Yeah, neonatal disease passage through infected birth canal. So, chlamydia trachomatis types L1, L2, L3 causes lymphogranuloma venereum is small painless ulcers on the genitals. Small painless ulcers on the genitals become swollen, painful inguinal lymph nodes that ulcerate. And then these ulcerations are called bubobes. Okay. Treat with doxycycline. Okay, so I'll show you what this is. Lymphogranuloma venereum is caused by chlamydia trachomatis. Lymphogranuloma venereum. Yeah, it's caused by granuloma. Okay. Oopsies. So this is what it is. So the first stage The first stage, small ulcer, contact site. Okay, so the first stage is this ulcer. That's ulcer. It's a painless. The second stage is dissemination through your lymph nodes. Bubobs, painful and cramps, constipation, discharge, malaise, muscle pain, joint pain. Bubobs, treat with doxy. Third stage is irreversible fibrosis, strictures, fistulas, elephantitis, anorectal syndrome. What is that? I don't know what that is. You don't have to know that now. Next. Okay, so bubobs. Yeah, this. Okay, this is a very painful. Okay, swollen, painful inguinal lymph nodes that ulcerate. Right here. The plague. Okay. So this is also seen in the Black Plague, and it's also seen in late. Not late stage. Well, I wouldn't say it's late. I would say it's a very bad case of chlamydia. Like that's how I would describe it. It's a terrible case of chlamydia. It's caused by types L1, L2, L3. So it's caused by one of the more potent types, I would say, of chlamydia. Bubbles is very painful, very painful, very painful, very painful ulcers. Okay. Also, um, the problem here is they're extremely painful, and this one has extremely bad complications if you don't treat it. Also, bulbs is extremely painful, and whereas it's different from syphilis, from primary syphilis, in that the chancre is not painful. Okay, so remember that. Now we're going to go into zoonotic bacteria. Zoonosis. So infectious disease transfer between humans and animals. Okay. Alright, so zoonotic bacteria, Anaplasma species causes anaplasmosis. It's transmitted by the ixods ticks. Ixods tick. What is ixods tick? Remember, we said ixods tick also transmits Lyme disease, which is Borrelia, which is caused by Borrelia, and it also ixods tick also transmits Babesia. Okay, so exotic transverse anaplasma, Borrelia, and and oh great. Okay, exotic transfers anaplasma, Borrelia, and Babesia. Yeah, Babesia. Okay, so remember that. Anaplasmosis. What is that? Anaplasmosis. Anaplasmosis. It's a disease caused by bacterium anaplasma. They have fever, headache, chills, muscle ache. Okay, so it's like a fever. Okay, causes fever, muscle ache. Causes fever, causes fever, causes fever, and muscle ache. Bartonella species is called okay. Bartonella species causes cat scratch disease and bacillary angiomatosis. What is bacillary angiomatosis here? Bacillary angiomatosis is this. This is what bacillary angiomatosis is. Remember, do not mix this up with the Kaposi sarcoma. Kaposi sarcoma is caused by. It's a well, it's a manifestation of AIDS. Kaposi sarcoma. I've seen it once in my life. It was oh great. Okay. So this is bacillary angiomatosis. Is caused by Bartonella species. Yeah, and it's from cat scratch disease. Bacillary angiomatosis. Bacillary. Sorry, bacillary. Okay, so that's bacillary angiomatosis versus Kaposi sarcoma. Um, so this is Kaposi sarcoma right here. Should we do this? Step 1 question of the day. 30-year-old woman with HIV comes to the clinic due to the recent appearance of skin nodules and progressive fatigue and anorexia over the past 2 months. Okay. She recently moved to Ohio and started working in the pet store due to recent appearance of skin nodules, progressive fatigue. She is currently not taking antiretroviral therapy, and her recent CD4 count 1 month ago was 80 cells. Okay, temperature is 100, pulse is 80, BP is 125 by 85. Physical exam shows multiple red, purple papules, some which are pedunculated and some bleed. Histopathology of one of the lesions shows vascular proliferation with some clusters of neutrophils and lymphocytes, which defines most likely pathogen responsible for the patient's presentation. Yeah, this is human herpes virus 8. It's caused by I believe so. Yeah. Because CD4 is super low. This is an AIDS patient. Kaposi sarcoma is what it is. I think that the reason that they the question here is some clusters of neutrophils and lymphocytes. Okay, I really hope that's what the answer is, because I remember some U-boat question talking about this. Oh my gosh. No, wait, hold on. I have to think about this now. She started working in a pet store. Okay, So she could be exposed to Bartonella Hensley. Let's see. BP influenza exam shows multiple small and red papules, some of which are peduncle and some bleed. Does Kaposi sarcoma bleed? I don't remember. I don't think so. Okay. Because typically one of the lesions shows vascular proliferation in some clusters of neutrophils and lymphocytes, which I find is most likely pathogen. Okay, I gotta change my answer. Oh no! I'm gonna go with. Oh my gosh. Because I don't think this one bleeds. I don't think Kaposi sarcoma bleeds. Okay, let's see. What does this lady have? Fatigue, anorexia. Okay, I'm gonna go Bartonella. Where is the answer? Yes, it's Bartonella! Okay, so before we go to the main explanation, let's look at the incorrect answer explanation. Skip to the bottom. Alright, see, basically what this is, the reason is that, yeah, I was so tempted to pick Kaposi sarcoma because um, because um, because their CD4 count is super low, patient is not compliant with her antiretroviral, and they describe Kaposi sarcoma. But my question was, I don't know if I don't think they bleed. Also, Kaposi sarcoma, I don't think they bleed, and also I don't think Kaposi sarcoma would have neutrophils in it. Let's make sure. That's why I was like, okay, the patient who is presenting with fever, fatigue, anorexia, and characteristic skin lesions most likely has bacillary angiomatosis. Okay. It's seen in cats. Cat scratch disease usually affects immunocompetent children, presents with regional limited lymphadenopathy, lymphadenitis, immunodeficient individuals, and bacillary angiomatosis, which usually occurs when CD4 is less than 100. Okay. All right. Oh, okay. Yeah, they bleed. Bacillary angiomatosis lesions, they become friable and bleed. Biopsy shows vascular proliferation with clusters of neutrophils. This is extremely important. I'm telling you, I these Euro questions, they don't play. There was a question about this, and I got it wrong that time, and I'm like, it would be unfortunate if I got it wrong today too. So, but I didn't, thank God. So neutrophils. So remember this. So cat scratch disease, bacillary angiomatosis. Okay, so I'm gonna make a note of this. Cat scratch, bacillary angiomatosis can bleed, can bleed, can bleed, and is so vascular proliferation with clusters of neutrophils and lymphocytes is, I'm gonna write, is filled with neutrophil, is filled with neutrophil and lymphocytes, filled with neutrophil and lymphocyte, and has and is seen in CD4 count, CD4 below 100, right? Then CD4 count less than 100, less than 100. Okay, now the reason we did not pick human herpes virus 8, Kaposi sarcoma is an angioproliferative disorder caused by infection with human herpes 8, often seen in immunocompromised patients. Kaposi sarcoma can involve virtually any site in the body. However, cutaneous disease is most common. The lesions of Kaposi sarcoma can be pink, red, purple, brown, or they tend to be elliptical, not painful or pruritic, and without necrosis. There are generally no associated symptoms. Additionally, histopathology analysis will show whorls of spindle-shaped cells with lymphocytic infiltration, not neutrophilic infiltration, as well as proliferation of small cells. Okay, make a note of that. That's extremely important. Okay, Kaposi sarcoma. Let's see. The difference between Bartonella. Okay, bacillary angiomatosis. Bacillary. Angiomatosis, bacillary angiomatosis. Okay, bacillary angiomatosis. You see neutrophils and lymphocyte. And then in Kaposi sarcoma, you just see lymphocytes. Spindle-shaped cell with lymphocyte infiltration. Only lymphocytic, lymphocytic infiltration. Okay, now next we're gonna move on. Okay, Borrelia burgdorferi is a spirochete. Borrelia, which one are the Borrelia leptospira and Triptonema, right? Borrelia, Triptonema and leptospira. Okay, these are spirochetes. Just keep saying that every time you say it so you don't forget it. Okay, so Borrelia burgdorferi it causes Lyme disease. It's carried by the Ixodes tick, which live on the deer and mice. Now, Borrelia recurrentis is relapsing. Causes relapsing fever. It's carried by the louse, recurrent due to variable surface antigens. I imagine the louse to be like a tick or something. Something that looks like a tick. What is a louse? Okay. Louse versus tick. Oh, so 1, 2, 3, 4, 8 legs. 1, 2, 3, 6 legs. So this 6-legged thing is a louse. It causes a relapsing fever. Okay. Borrelia burgdorferi, it has 8 legs. It causes Lyme disease. Now, Brucella species. Let's go. Brucella. Where is it? Oh yes, Brucella causes brucellosis, undulent fever. What is undulent fever? I believe that's high-low fever. Undulent fever. Is a rising and falling fever. Yeah. Okay, undulent fever is rising and falling fever. Right. Okay, rising and falling fever. Okay. Brucella causes brucellosis, and you get this by unpasteurized dairy. Okay, brucellosis. Let's see, brucellosis. What is brucellosis? Okay. Remember unpasteurized milk. Oh, this is Mediterranean fever, caused by ingestion and unpasteurized milk. Fever, sweats, back pain. Okay, cool. I'm gonna write that. Brucellosis fever. Cause underlying fever, headache, non-specific symptoms. Fever and headache. Okay, now we have Campylobacter jejuni. Remember we talked about Campylobacter? Campylobacter jejuni is from feces from infected pets, like dogs. It's on the inside, it's on the intestines of chickens. So in feces from infected pets, animals contaminated meat, food, hands. So yeah, feces from infected pets. If somebody touched those poop, like pet poop, and made you food, you can get Campylobacter. It's bloody diarrhea. It causes bloody diarrhea. Okay. Now Chlamydophila pistachii is found in parrots and other birds. It causes pistachiosis. Okay, what is that? Pistachio? I think that's a pneumonia. Okay, so parrot fever. Sudden fever, chills, headache, muscle pain, and you can get pneumonia. Okay, muscle pain. Okay, I'm gonna write that. Muscle pain, sudden fever. So sudden fever, and pneumonia. Coxiella burnetii. Next is Coxiella burnetii. Coxiella burnetii causes Q fever. It's transmitted by aerosols of cattle, sheep. Okay. Coxiella burnetii causes Q fever. It's transmitted by aerosol of cattle and sheep amniotic fluid. Okay. Sheep amniotic fluid. Ehrlichia chaffiensis causes ehrlichiosis. Okay. It is transmitted by the Lone Star tick, also known as amblyomma. But amblyomma, okay, I'm just gonna remember that as your mama. Ehrlichiosis is what is that? It is okay. Signs of fever, lethargy, nasal and ocular discharge, unusual bleeding, swollen lymph nodes, weight loss. Okay. Vomiting, diarrhea, weight loss. Alright. It's caused by the Lone Star tick. What is Lone Star tick? So this is the tick. It's a six-legged animal. Right here. It causes ehrlichiosis. Okay. Transmission. But where do the ticks get it from? Monster tick. Okay, monster tick is a malaria. I think it bites animals like a dog. Let's see. Monster tick. Where is it? Female lays egg. It goes. Larva. Okay, it goes. Lives on this like deer. Then it goes to adults. Then it goes to dogs. Okay, so it can bite. I mean, so they have. Did they just have this? Yeah, okay. So it just says that. mm, okay, so these ticks, I'm going to assume they just have them in their body. They just transmit them by moving from host to host, and finally they'll bite a human. That's why it gets. That's why it gets. That's why we get these disease. That's why we get eclideriosis. Fever, chills, headache, upset stomach. Fever, chills. Fever, chills, upset stomach. Okay, so yeah, carried by monster tick. Um, Francisella tularensis. Okay, this causes tularemia. Tularemia. It's transmitted by ticks, rabbits, and deer flies. Tularemia. Tularemia. Rabbit fever. It's also known as rabbit fever. These are the symptoms. It's a gram-negative coccobacillus. Gram-negative. Gram-negative coccobacillus. Uh, High mortality. Interesting. I don't know tularemia. I did not know tularemia was fatal. Oh my gosh. What? I'm not touching rabbits anymore. Oh my gosh. Bacterial disease can affect both people and animals. Like Francisella to learn about rabbits, rodents, hares. Okay. Okay, so can be rabbit fever that can be fatal. Rabbit fever that that can be fatal. Okay, Leptospira. Leptospira is a spirochete. What are the spirochetes? Leptospira, Treponema, Borrelia. So, leptospirosis is transmitted in animal urine in the water. Think of like people who go surfing. Think of surfers. Okay. Surfers. Surfers are prone to get leptospira. Okay, leptospirosis. What are the symptoms of leptospirosis? Flu-like symptom, conjunctival suffusion. Think of Weil's disease, which is severe form of jaundice, severe form with jaundice, and azotemia from the liver and kidney dysfunction, fever, hemorrhage, and anemia. So think of Weil's disease. Remember, think of Weil's disease and think of surfers in Hawaii. Surfers in Hawaii. Okay. Mycobacterium leprae. This causes leprosy. Humans with lepromatous leprosy. And so, where do you get this? Is from humans with leprosy. And you can also get it from armadillos. Remember we talked about armadillos in Texas? Yeah, don't touch armadillos. Okay, Mycobacterium leprae. Oh, we just said, yeah, it causes leprosy. And Pasteurella multicida causes cellulitis and osteomyelitis. You can get it from animal bite, cats, and dogs. Okay, Pasteurella. Rickettsia prowazekii. It causes epidemic typhus. What? Epidemic typhus? Human to human. It's transmitted by human to human by human body loss. Epidemic typhus. What is that? Epidemic typhus. Epidemic typhus. All right, so Rickettsia prowazekii is can be fatal. This is not typhoid, okay? Typhus is different. Can be fever that can be fatal. Fever, I think it's above 105. Yeah, high fever of 105 to 106. High fever of 105, 105 to 106 can be fatal and can be fatal. Okay. Muscle joint pain, dry cough, rapid breathing, nausea, vomiting, confusion, decrease alertness, delirium, low BP. Okay. Low BP, low BP. Um, Rash that starts on the chest and spreads to the rest of the body except for the palms as well. So rash that starts on the chest and spreads to the rest of this. Rash starts on chest and spreads to rest of body except for palms and soles. Okay. Mm, Human to human, and then it's transferred by human body louse. Okay. So the louse, it carries this in its poop in its GI system. Then that louse goes and bites a human, and the human has open cut, and then and because of that, the louse infects. The louse infects the um, the person's blood, and that's how they get this. They keep getting the louse keeps transmitting this Rickettsia prowazekii. So, endemic type is spread from insects and other parasites bite you and leave bacteria-laden feces on your skin. You can spread the infected feces into your open wounds or other cuts on your skin surface, moving the typhus bacteria into your blood. You can spread the infected feces when insects and other parasites bite you and leave bacteria-laden feces on skin. Okay, so yeah, they bite you and then their poop, the insect poop, stays on your skin and goes into your cut. Yeah. All right. Rickettsia causes Rocky Mountain spotted fever. It's carried by the dog tick known as Derma center, and then I think no. Okay, Rickettsia typhi causes epidemic. Yeah, Rickettsia typhi causes endemic typhus. This one is transmitted by fleas. Okay, endemic typhus. Endemic typhus. It's known as flea-borne typhus or murine typhus. Rickettsia is caused by bacteria. Rickettsia typhi is transmitted by fleas using rats. It can be spread by dogs or possums. It's a disease caused by bacteria called Rickettsia. Okay. Endemic typhus symptoms. Okay. Fever, headache, chills, weakness, nausea, vomiting, body ache. Yeah. Okay, it's transient. It causes fever. Fever, headache, joint pain. Okay. Fever. Transmitted by fleas. Salmonella species, except for Salmonella typhi, cause diarrhea, which may be bloody. vomiting, fever, abdominal cramps, and a salmonella species is carried by reptiles and poultry. Yersinia pestis causes the plague. It's transmitted by fleas. The rats and prairie dogs are reservoirs. Okay, what are prairie dogs? What are prairie dogs? Prairie dogs. What are prairie dogs? These are prairie dogs. They're cute, aren't they? Okay, fleas. Rats and prairie dogs are reservoirs. The fleas bite the rats and prairie dogs, and then the fleas bite humans. That's how we get the plague. Okay, so Yersinia pestis is very important to know. I'd love to ask about Yersinia pestis. Yersinia pestis can cause DIC. DIC, it's from an endotoxin. Um, okay, Yersinia pestis, YOPS, secreted by type 3 secretion system, and YOPS causes macrophage and neutrophil dysfunction by inhibiting phagocytosis and cytokine production. This allows Yersinia pestis to multiply rapidly and spread. Treatment is by streptomycin in combination with tetracycline. There is a killed vaccine that can be used for the prevention of Yersinia pestis. So Yersinia pestis can cause DIC from an endotoxin. YOPS, secreted by type 3 secretion system, and YOPS causes macrophage and neutrophil dysfunction by inhibiting phagocytosis and cytokine production. This allows Yersinia pestis to multiply rapidly and spread. Treatment is by streptomycin in combination with tetracycline. There is a killed vaccine that can be used for prevention of Yersinia pestis. YOPS is Yersinia associated outer protein. Okay, so this is just a note that I made, so you should know that Yersinia pestis can cause DIC from endotoxin. YOPS is Yersinia associated outer protein secreted by type 3 secretion system, and this Yersinia associated outer protein causes macrophage and neutrophil dysfunction by inhibiting phagocytosis and cytokine production. This allows Yersinia pestis to multiply rapidly and spread. Treatment is by streptomycin in combination with tetracycline. There is a killed vaccine that can be used for prevention of Yersinia pestis. Okay, now rickettsia, I'm just going back through the list. Rickettsia, so we did the list. Okay, so Rickettsia typhi, endemic typhus, is caused by fleas. It causes fever. It is not typically fatal. Now, Rickettsia prowazekii is more often fatal. It can cause extremely high fever, 105 to 106, and it has a body rash that starts in the chest and spreads out to the rest of the body, sparing your palms and soles. And an epidemic typhus is caused from human to human by human body loss. Okay. All right. Brucella. I keep forgetting what brucella is. Rising and falling fevers from unpasteurized milk. Okay, fine. Next. Tularemia is rabbit fever. Leptospira is you get it from animal urine in the water, so think of surfers in Hawaii. Pasteurella multicida. Keep forgetting what that is too. Pasteurella. Let's see. Pasteurella multicida. You get it from dogs and cats. Scratches from dogs and cats. Pasteurella multicida. It's a gram-negative It is a gram-negative coccobacilli, non-motile, insensitive to penicillin. Coccobacillus facultative, anaerobe, does not need oxygen to survive. It has a polysaccharide capsule. What it does is pathogenic pathway, cow hemorrhagic septicemia in cattle and buffalo, atrophic rhinitis in pigs. Okay. Okay, so basically it's found in animals, farm animals, pets, bites, licks, scratches. If a dog or cat, infected dog or cat scratches you, can get it in skin or soft tissue infection, blood infection, systemic infection, death. Oh, I see. So immunocompromised, if somebody that's immunocompromised gets it, you can die. Somebody that's immunocompromised gets Pasteurella, you can die. General population causes skin issues. Okay. Pasteurella. Where's this? Pasteurella. Okay. Pasteurella. Yeah, skin infections, exactly. So Pasteurella causes cellulitis or osteomyelitis. Okay. Pasteurella. Pasteurella causes skin infection. Causes skin infection. It causes skin infection in healthy people. Healthy. Human. Okay, so Pasteurella found in Pasteurella found in cats, dogs, farm animals, cats, dogs, farm animals, cats, dogs, farm animals, and they bite humans, and they bite humans, and they bite humans, and they bite humans, causing Pasteurella, causing Pasteurella multicida. Okay, yeah, that covers all of zoonotic bacteria. So we're gonna quickly go through the last page of first aid right here. Rickettsia disease and vector-borne illnesses. Okay, treatment is doxycycline. So you always think of doxycycline when you talk about rickettsia. Rocky Mountain spotted fever. Is caused by rickettsia. Vector is tick, so it's transmitted by a tick. Rickettsia is transmitted by a tick. Despite its name, disease occurs primarily in South Atlantic states, especially North Carolina. North Carolina. Rash typically starts at the wrists and ankles and then spreads to the trunk, palms, and soles. Okay. So in Rocky Mountain spotted fever, the rash starts in the wrist and ankles. Okay, it starts here, wrist and ankles, and then spreads. Starts in the wrist and ankles and spreads to the trunk, palms, and soles. Okay. starts at wrist. So A over here, I'm gonna label. This is a Rocky Mountain spotted fever caused by rickettsia rickettsii. Rocky Mountain spotted fever, spotted fever, Rocky Mountain spotted fever caused by rickettsia rickettsii, caused by rickettsia rickettsii, rickettsii. Okay. It is made. This tick is found in North Carolina. Okay, it's found in North Carolina. Okay, rash starts at the wrist and ankles and spreads to the rest of the body, and includes the palms and soles. Rash includes palms and soles. Okay, all right. Classic triad is a headache, fever, rash. Classic triad is headache, fever, rash. Yeah, classic triad is headache, fever, rash. Why did it say vasculitis? Classic triad is headache.